We can see properly now, madam. We can see
Right.
properly, madam.
Right. Okay. All are there? My, can you all hear my?
Yes, madam, we can hear. I'm muting my mic because the word is very noisy.
Right. Okay. Student, you can also go to the front room නේද එහෙමනම්? Front room එකට යන්න ඔක්කොමලාට. එතකොට ලේසියිනේ.
I'll get them there.
When you are ready, can you tell me that to start? Students, are you all ready? Hello, are you ready?
Yes, madam.
Right. All are there?
Yes, madam.
Right. Okay. Because of the screen, I can't see any of you. If you have any issues, just stop and if you have any issues, let me know, right? Okay. Hello.
Hello, madam.
Yes.
Okay, madam. We
Right.
will
You
let
are
you
in.
know, madam, if there's any.
Sorry?
Yes, sir.
Right.
I'm in
So
Oka,
you.
madam.
Right. You are in the front room there.
Yes, madam. We are moving to that room, madam.
Right. If there's any problem, you stop and talk to me, right?
Okay, madam.
Right. Okay. When you are ready, let me know.
Okay, madam. Okay.
Shall we start then?
Madam, we have to arrange the chairs. It will take
Right.
few minutes, madam.
Right. Okay. Like talk about management of attempted suicide patient. Yeah. So I will first give you a scenario and we will discuss the scenario later, right? Now, it's like a 56-year-old married lady with 2 children admitted to medical ward with a history of injecting an overdose of insulin. And we need to assess the suicidal risk of this patient, right? So after the discussion, I will halfway through, we will discuss how we can assess the suicidal risk, right, of this patient, right? Now, when you are assessing suicidal risk, there are 2 things that you need to assess. One thing is the suicidal intent of the person, right? Whether the person wanted to die actually, right? What are the things what are the factors suggest that this person is having a high suicidal risk or high suicidal intent, right? They have the idea to die, right? So there are certain factors that you have to know, so that we can say that the person is having high suicidal intent, right? So one thing is act carried out in isolation, right? They have done it when no one is around, and they knew that there won't be anybody around, and so they know that they will not be identified, right? Act carried out in isolation. Second one is act timed in a way that interventions were unlikely, right? So that nobody will be able to do anything to this person to like save the life, right? Okay. For example, if they have taken when the daytime, when everybody is not in the house, or in the night, right? Or we're going to a jungle and taking it, or going to some sort of an unknown place and taking it, right? So this is like act timed in a way that interventions were unlikely. No one will be able to do anything, right? Then precautions taken to avoid discovery. Like sometimes they will lock the door and do various other things so that they will not be able to take these people for treatment, right? To after taking the or doing some harm to themselves, right? Preparations made in anticipation of death, making a will, organizing insurances, and things like that, right? Now, for example, in our country, they go and visit all the people that they have, and sometimes they give calls and call them and say that how you are, and I just want to talk to, and things like that, right? There are some disturbances. Yeah. So preparations made in anticipation of death, right? They will think in that they are like a goodbye message, like that, right? So they will be sit and tell things, and they will some people some patients relations tell that before the attempt the patient was very happy, right? And they visited us, so they never thought that these people were this person is going to attempt, right? So so that type of picture is there, right? Then preparations made for that, like they purchasing tablets or saving tablets, or like buying these insecticides, buying ropes and things like that, right? And keeping them so that they can do it. Like sometimes they arrange it in a such a way that that at the end the people will feel comfortable, right? Okay. And communication of intent beforehand. So they will though they will not tell that the before the act that suicidal, I want to kill myself, but they will tell these things beforehand, like about 1 week, 2 weeks prior. They will tell that. Sometimes people say that most of them go and tell their doctor that I want to die, right? There's no hope and I want to die. Sometimes they will go and tell very close people that they are going to kill themselves, right? So this is a very important important factor that that prevention can be taken. So if somebody is communicating about suicidality, you have to take it very seriously, right? So you can't just ignore, right? It's a joke, and why do you want to die, and you have everything and you need not do anything much about it, and things like that. So people used to tell, but you have to take everything very seriously. If there is a suicide, you need to act, right? So in the subsequent slides, we will be discussing how to assess the suicidal risk. So depending on the risk, we need to attend to various things, right? Then the other one is extensive premeditation. they plan it in a certain way, like they think about this suicide. Now sometimes they plan for many months, right? And this is what I'm going to do and how I'm going to end my life and things like that, right? So sometimes people wait until the daughter get married or son get married, or the children enter universities, or that some people come and visit them and go. So they wait for that time. So they have the premeditation, like they plan it, right? Okay. Uh, yeah. Sorry, I have. Yes. So these are the some of the factors that that you need to look for. One thing is that what we have discussed. So there are objective indicators and subjective indicators. So objective indicators are isolation, likelihood of intervention, precautions taken of discovery, action to get help, preparation for death, preparation for attempt, suicidal note, communication of the intent and purpose of the attempt, expectation of death, perception of method of lethality, view of attempt seriousness, desire to live or die, then perception of curability and premeditation, right? So these things are we need to look for. I think I have some messed up with some slides. We will go and see whether something has happened. Right? Okay. We'll come back to that. Right. Okay. So if we'll just discuss these things also. We discuss about action to get help, preparation for death, preparation of the attempt. They plan it, and they sometimes they leave suicidal notes, and then they communicate about the intent we were discussing about. Then we need to find out why this person is attempting, purpose of the attempt, right? And then expectation of death, right? They want to die, right? So they have the idea that they will die with this, right? And perception of methods of lethality, like if they know that this by doing this, definitely I'm going to die, right? View of attempt seriousness, right? Then what are the view that whether it is a serious one or just like a thing that they just tried it to see, right? Desire to live or die, right? Perception of rescuability, the ability to rescue the person, and premeditation, right? Okay. So these are the things you have to look for when you are looking at the suicidal intent. So if you take the patient that we have taken initially, we were taking a patient who is a 56-year-old married lady with 2 children admitted to medical ward with a history of injecting an overdose of insulin, right? So we need to assess the suicidal intent. So in order to identify that, we need to get more details, right? So these are the details that we have been able to obtain. She had been showing depressive symptoms during the last 1 year with loss of appetite, feeling low, lack of interest with worthlessness and hopelessness. And her intention was to die. The intention was to die. She has messaged her niece thanking her for helping and doing everything, and what she had done for her and things like that. And she had done it in isolation and not a premeditated death. It was like she just thought, like they have not been like thinking it for a long time. And she had left a suicidal note, and she had not alerted any potential helpers after the act. And she admitted that she was having a suicidal intent, right? So with that, I think I told that I have messed up with some slides. I think this is the where the messed up is. So just leave that the previous slide that I showed you. Just keep it. This is the one that she was having. The need to relieve her suffering. Had not asked for help. No suicidal note. She had not overtly communicated the intent to anybody. She knew it was a lethal dose, and she knew that it was a serious act. And patient did not think it was a reversible method, and patient is not happy about her survival, right? So this is what we have got. And in your books, in shorter textbook of psychiatry, I think, Udara, have you got this in your new book as well? Beck suicidal intent scale. Hello? Hello?
No, madam.
You don't have this. Right. So the old book, it has got this note. So I think we will be having a book in the ward also. I just remind me to give this so that you can get a photocopy of this and give it to photo of this copy and give it to the students as well, right? So this gives an idea about how to assess the intent of the suicide. This is like same things that we have discussed, but they have given some scoring system, a scale, right? So this is very useful in for us to assess the suicidal intent of the person, right? So with this suicidal intent, if the Beck suicidal intent scale between 0 to 6, that means there is low suicidal intent, right? And 7 to 12, you get moderate suicidal intent. And if it is 13 to 20, then you get high suicidal intent. And if it is more than 21, very high suicidal intent, right? So this is only we are talking about intent to die, right? They have the idea to die, right? So what intention the patient had in order to die, right? So why this is important is, now if the patient is having a high suicidal intent, there is a high chance that they will repeat the act, right? So in management of these patients, what we need to do is to prevent another attempt or prevent a suicide, right? Because we don't know at what time that they will die with a suicide, right? So to assess it, we need to know what the suicidal intent of this person. So whenever you are talking about a suicidal risk assessment, you need to talk about the suicidal intent of the person also, right? So it's very important to emphasize on that. What is the suicidal intent? They have shown that even many years later, person who had a high suicidal intent, they can die by suicide, right? So previous suicidal attempt is a risk factor for a subsequent suicide, right? Or subsequent suicidal attempt. So we need to be assess this very carefully to see what the suicidal intent of the person, right? Okay, right. Hope everything is clear. Students?
Yes, ma'am.
Right? You are clear about this, is it? Hello? Udara, are you having any issues?
No, madam. Actually, madam,
right.
we have a bit difficulty in switching on the microphone because everyone is in the same place. It gets
right,
echo, madam. That's why we take time to answer, madam.
Right. No problem. Right. I understand it. Right. There's no problem. Right. If I get to answer, that's enough. Right. Okay. Right.
Okay.
So you are quite familiar with this word now, suicidal intent, and how we assess it, and what is the importance of it, and what is the scale that you need to use. You are quite clear about that, isn't it?
Yes.
Right. Okay. Now, once we assess the suicidal intent, then we need to assess the continuing risk of suicide. Right now sometimes they might be not having a high suicidal intent this time, but they might have a high suicidal intent later on. Right, we never know that. Right, because our minds are such that we just because one person has one suicidal attempt with low suicidal intent doesn't mean that the person is not going to attempt suicide next time. Right, so there are other factors that will tell us the person is having continuing risk of suicide or attempted suicide. Right, all right. So this is another that we have been discussing earlier. There's this 56-year-old female who had tried to attempt suicide by taking insulin overdose. So she had been worried about daughter's mismatched relationship, and her marriage was not a peaceful marriage as there was a gender-based violence and husband was alcohol dependent. And she had been separated for a few years, but now they live in the same house. She had been suffering from diabetes since the age of 26 years, no family history of mental illness or suicide. She has had a past history of depressive illness where when she was 18 years old, current episode not improved with the oral medications, and her children are supportive. Right. So if you take this case, right, there are current problems. Right. There are current. Now we need to look at the current problems the patients are going through. So intimate relation problems, right? Then relationship with children and relatives. Then employment, finances and housing, legal problems, social isolation, bereavement and other losses, right? So this is one thing that that we need to assess. After assessing the suicidal intent, then we need to assess the current problems, what the patient is having, right? Okay. Then we have to assess the mental state. Mental state examination will tell us whether the person is having any risk factors that will will help or will increase the suicidality of the person, right? So mental state examination like retarded, soft audible speech and monosyllabic, subjectively and objectively depressed, active suicidal ideas, hopelessness, nihilistic delusions, and oriented in time, place, and person. Right. Right. So these are the things we need to assess in the mental state examination to see whether the person is having a depression or not, isn't it? Right. So we need to assess that. Right. Then is there a continuing risk of suicide? Right. So now this is also another important thing that we need to assess. Did the patient originally intend to die? Right. Now we assessed it. We assessed it at the beginning with suicidal intent. Then we have to assess, did she intend it now? Whether the person wants to die now, right? Then the third thing is, are the problems which provoke the act still present? Right? Now the person who had attempted suicide is the problem. The problems that the person is having is still present, and is he having a mental illness? So those are the 4 questions that we need to answer in order to assess the continuing risk of suicide, right? So when it comes to psychiatric problems, depressive disorder has a lifetime risk of untreated 20% of the people will commit suicide, and alcohol use disorder lifetime risk is about 7%, And schizophrenia, lifetime risk is about, again, 7%. I think personality disorder, they said about 10%. Isn't it, Tudar? Recent discussion?
10 to 20. 10 to 20. Like, madam?
10 to 20, ne?
Yes, ma'am.
Yeah. Mathematical 10 kiyala, right? So personality disorder people also can commit suicide about 10%, right? Okay. Yeah. Then we have this sad person scale, which will help us to scale out the future suicidality of the person, right? This is what in future, whether the person is going to harm themselves or not, right? This can be like used as a cross-sectional thing as well as the longitudinal thing. In suicidal intent was a cross-sectional thing. Right? It will not tell us, it will give some idea about the longitudinal suicidal risk. In future, what will happen? But it is mostly it can change. The suicidal intent can change from time to time. But these things generally are fixed things so that we can see what the patient is having, right? So sad person scale is SADPERSONS S, right? Okay. So sex male 1, age less than 19 or more than 45 1, depression or hopelessness 2, then previous suicidal attempt or psychiatric care 1, excessive alcohol use 1, rational thinking lost means like hallucinations or delusions. So we then we give 2, separated, divorced or widowed 1, organized or serious attempts 2, no social support 1, stated future intent 2. So if the score is 6 to 8, we need the emergency psychiatric evaluation, and if it is more than 9, needed immediate psychiatric hospitalization, right? So this is where the sad person scale is used in the assessment of future suicidal intent. So this thing can be used with the help with the suicidal intent. Now, suicidal intent come in here as an organized or serious attempt, right? So this is where the only one factor is in the sad person scale. But when it comes to assessment of suicidal intent, there are a lot of other factors that we need to look for, right? So this organized or serious attempt is the thing that we are looking at in the suicidal intent, right? Clear? Is it clear?
Yes, madam.
Right. Okay.
Yes, madam.
Yeah. All right. Yes. Right. So now in the management, we have to find out what is the motive or reason for deliberate self-harm, right? It's a very, very useful thing for you to do it, because that will help us to in the management, right? So that is a very important thing. These also, they are in your books, shorter text book of psychiatry. So you can have a look and keep it in mind. So that will help us in the management. So one thing, motive may be to die, right? They want to die, right? They have a serious suicidal intent and they want to die, right? Then sometimes they do deliberate self-harm to escape from unbearable anguish, right? Where there are a lot of issues, they want to escape from the issue, so they attempt suicide, to sleep for some time or get away from there is no way that they can get away from the situation, so they just attempt and they want to sleep. They didn't have didn't have the idea to die, but they want to get rid of this unbearable distress, right? Then to get relief, some sort of a relief from some problem, right? and to change the behavior of others, right? Especially this personality disordered people and like some manipulative people, they tend to they think by attempting suicide they can change the behavior of others. Now sometimes this happens, sometimes it works, especially if the parents doesn't approve the relationship of a teenage. They attempt suicide and the parents get scared and they say, okay, if you want to do whatever you like, right? So that type of things can happen, change the behavior of others to escape from a situation, right? From like now, sometimes people who have been taken into remand, they try to attempt suicide so they can be hospitalized, so they will not be no need to be in the remand, which is very difficult, right? To show desperation to others. Now, sometimes, unless you behave like this, people will not understand that the situation that you are going through, right? They will tell that okay, this is what is going through, and you have to bear with this. This is normal and things like that. So when they want to show others that how desperate they are, they will try to uh, do this harm. And to get back at other problems, people make them feel guilty, right? So to make them feel guilty, they might attempt suicide. Now, when it's a broken love affair and things like that, they will tell, I will if you stop the relationship, I will commit suicide, right? So they will attempt that, right? And to get help, right? So when they want help also, they will attempt suicide. So keep this in mind. That is very, very useful in the management of the person. So why this person attempts suicide? So you need to ask the question why, right? It's very easy to then find solutions, right? So in the management, depending on the suicidal intent and the suicidality of the person, so we have to have admit this patient, and we have to have a safe ward environment. That is very important, right? We have to have a one-to-one observation, and we have to have a safe ward environment and adequate well-trained staff. You need to have a well-trained staff to manage this patient, and clear policies for assessment, review, and observation, right? So the ward should be like geared to manage these patients, right? So they have to know like what one-to-one assessment is, how often do you need to assess the person's behavior and mental state, and what to do, and how to review, and how to observe, and all those things we need to assess, right? Then the next step would be, once you admit the patient, you have to assess the risk again and remove like objects that they can harm themselves. Like sometimes they will be keeping knives, blades, and sometimes tablets, sometimes poison bottles, like various things. Sometimes they keep glass pieces. So we need to assess them, see what objects that they are having. In other countries, they can keep guns even, right? Then we need to discuss the plan with the patient. What are we going to do, and what steps that we are been taking. We understand that you are always be empathetic. Don't be angry with these people, because they need help, right? People who attempt suicide, they need actually help. So you have to be very empathetic and discuss the plan with the patient, what we are going to do, and what help that we are going to give them, right? And then we have to agree with the policy for visitors. Like not all of the time, if the patient is in severe suicidality, we can't allow a lot of visitors to come and disturb the patient and things like that. So we can, and sometimes the patient also will not like some people coming and seeing the patient. So we have to have a agreed policy for visitors. Then during admission, we have to, while the patient is in the ward, you have to like regularly review the risk and the plans with the patient and clear plans or level of supervision, right? There are, if it's very high, you need to do what, and the secondary level and things like that, what you need to do. And if the patient leaves the ward, take immediate action. So sometimes they try to abscond from the ward, right? So you need to inform police, the family, the security, alert the security, and we need to see what actions that we can take to save this person. Like I can remember a suicidal patient had escaped from the ward and gone to some place in the like in a jungle in the town and had hang himself, right? So these things do happen. So we have to be very, very vigilant, and we need to be aware what to do and inform police and inform family and get them, right? Then sometimes we, in our setting, we keep a bystander with the patient, so that because we can't give that much of one-to-one care. But the problem arises when there are no bystanders, so patients doesn't have any people around, right? Then you have to treat the underlying psychiatric illness, right? It can be depression, schizophrenia, personality disorder, alcohol dependence. So you need to look for it, right? Then arrange multidisciplinary team intervention, right? It is also important to, I told you at the beginning, right? So they attempt suicide due to some reason, right? So we need to attend to that problem. Unless you attend to that problem,